Okay. That's my name. What's yours? What is
Hi,
it?
everybody. Welcome
Oh,
to
okay.
Monarch Family Chiropractic and Spinal Workshop Tuesday night. We're going to talk about loving on our spines, loving on our muscles, and we're going to go through some foam rolling tips. So we're going to make this sweet, fast, down and dirty. We're going to go through things we've done before, but we're going to do a more rhythmic way. And we're going to add in a few different things that we haven't done in the previous workshop. So there's going to be a couple newbie moves, if you will. But for the most part, you know, the muscles are the muscles, the body's the body. It's designed to be in motion. So we talk about, you know, motion is function and function is motion. Our bodies are not designed to be sedentary or still. So when we talk about, we are a muscular skeletal system, right? So most important is that our nervous system and our spines, our structure, have the proper position and mobility and function to them. And then we want to work on the components that attach to them, right? And which that's the muscles and the ligaments, so those tendons, and then the fascia. The fascia is like some of that bridging of the gap. I describe it like a spider web. It is this very intricate layer of tissue that's different than muscle, that's different than just the tendon that attaches the bone to the muscle. And so that fascia is things like our IT band, and there's things in the bottom of our feet, right? And there's that interlying fascia tends to really attach sort of the connecting points between the body. So when we get to those points, they're very much affected by a foam roller because they're not muscles. So they need different type of work than a stretch. So we're going to go into those in a way to do your whole body in really under about 10 minutes. So this will go slightly longer because I'm going to talk you through the rotation we're going to do. But I want you to think every single time that we do a motion, I'm going to try to interject, and I want, you know, everybody here interjecting and reminding me that when we're doing something, it's almost like, okay, well, who does this affect? What kind of person would want to do this type of rolling? And it's all of us, because we all are moving, doing different things, whether it's a position that is at a desk all day, if it's a position that's holding a baby or nursing, if it's a position that is an athlete doing very repetitive motion or has had injuries, if it's a person who has had repetitive or trauma to a structure or a sprain strain, whether it's an ankle, whether that's a knee or a hip, or whether it's a shoulder or a wrist, all of those things are connected in the center at our structure through our muscles and our ligaments, and then to our spine. So, or the attachments to our spine, right? Our hips, our shoulders, and you know, down to knees and ankles. So it's a whole chain. And when you hear me talk about the body has to play like a team, we want us working as a unit, not parts and pieces. So as I said, form, it really goes into movement. Movement is that mobility, and mobility gives us the functionality we want out of our body. So as we're designed to be in motion, we want to talk about how we're going to get the most support and the most love by getting proper motion, right? So there's a difference in moving, and there's a difference in moving properly or moving well. And so let's go into the first motion. So we're going to start on the spine, and I'm going to work my way through. I'm going to follow some notes because I just want to make sure I'm going in a sequence that seems easy to do and not like you're flipping over and then turning and then changing positions. So if there's things that I go through quickly, then I'd say maybe watch one of the workshops on foam rolling from 4, 5, 6 months ago and in 2023, because we're doing some of the same things but in a slightly different way, and you might just pick up a different way to do it or a different way I explain it. So there's multiple workshops we've done on this, but we're going to go through a routine as if you've done some rolling before and you're just trying to find a good rhythmic way to do it routinely and quickly. So that this is not a hang out and stretch on for 15, 20, 30 minutes. Absolutely not. You don't need that much for a foam roller. This is getting at adhesions or little trigger points that are happening within the muscle, within that fascia, within that tendinous sheath. And so you're just noticing them and rolling through them and then moving on. So what I'd say is this is a great thing to throw in your routine weekly. You may find an area you want to hit every couple days, but this is not something you do every day. I think once you get into a rhythm of it, it really doesn't need to be as frequent. And you stay on top of it. So when people don't like foam rolling, it's because it is uncomfortable at times, and you get on trigger points that don't feel great. Yet there's a reason they don't feel great. So when we do them more frequently, they actually get to be, it feels more comfortable, and you can really tell that you're keeping it loose and mobile, and you really then don't have to do it often. So having a consistency for you is really key to where it's not painful and this love-hate relationship with this thing. And you're actually getting mobility more frequent so that it feels comfortable and less adhesive, so that it's just gonna move better and move smoother for longer. So as we get right into it, we're gonna start on my favorite, which is our spine, and a way that people don't tend to think of how to work on the muscles, what we call the erector muscles that run, and those postural muscles that hold you upright and hold that spine in place. So as I go to the floor, we're gonna start with the spine, and then we're gonna move our way through upper body, lower body, front of the body, and sides of the body. So I may say muscles, and if they don't names, and if you don't know what they are, or I'm going a little fast, then just write those down, jot those down, put them in the notes. We can try to touch base here at the end and answer any questions of what they are. Or I always say, write that down and then use our $1,000 computers that are in our pocket and Google that muscle name and see, it'll show you probably a picture of the body, an image of the body. Or that's a great thing to bring in and ask us, hey, she went over this, she called it this. Are we talking about the same thing? Because the more you know, the more you're able to communicate either to us, a massage therapist, anybody that's doing body work on you, what things are talking, what things give you signals, right? And then that helps us all support you in your care. And so without further ado, as we love on our spines, the easiest way to work on the spine, left and right side of it, that is a hard area to reach on your own, is with a roller. And I would say there are different sizes. If you're gonna spend any money, I would just get one that is this 3 foot, 36 inch by 4 inch diameter. This is the best for all sizes really and shapes, and let you do the most with the long one. And it isn't too wide like the 6 inch diameter ones, as far as a smaller frame and getting in between some of these places like the spine and between the shoulder blades. But if you have a thicker one, that's okay too. It's just the length is, you're gonna be able to do the most with it. As you see, as I lay on this, I want my head and my hips to be resting on it so that you don't have one part hanging off and you're trying to control what your body's doing instead of just rolling. So you're going to sit on one end and you're gonna rest your back on the other end, as well as your head, so that you're not holding any of your body weight. And knees are always going to be bent, feet are going to be on the floor. So you're supporting that low back and letting the low back kind of press against the roller. So there's no big gaps here. And because my whole spine is over this roller in my head, there's not one uncomfortable pinpoint spot anywhere because I'm distributing my weight pretty evenly over it. So we are going to roll left and right. So I'm going to roll, if you will, towards you and then away from you, and up and down, or side to side, I should say, left to right. And I really go 3 to 5 times, both directions, on all areas, depending on how it feels. So then the motion we're going to come back to this at the end, but then what I want you to feel what it's like to do the perpendicular direction to get everything coming through from the low to the mid. So at your lower rib cage, rest against it, knees are bent, and you're going to, if you want to, lift your buttocks off the floor or just crawl with the hips on the floor. So it depends how much weight you want to put on it. If you can handle more, you can lift up and put more body weight against the roller and roll up to the shoulder blade and back down to the bottom of the ribs. And back up to the shoulder blade and back down. And if you get to where you're like, oh, I feel some stuff, can you move your arms? Once you learn how to balance on this, then when my arms are up here, what does that feel like? That's very different underneath those shoulder blades where we get all those trigger points that our massage therapists put their elbows in, right? That's how you get into those. You move the arms out of the way. So kind of think about your wall angel. Get your arms out to the side, get your arms overhead, and just see where you feel those differences, okay? Then we're gonna work our lats and our rotator cuff muscles. So these are ones that just help us do that motion of putting our arms over our head or in front of us or those types of movements. And many times it's the small muscles underneath the shoulder blade or almost in our armpit that become the most underworked or overworked in a way, or in a sense, where you're not getting enough muscle work or movement on them. So you then overuse the big muscles like your delts and your traps and your pecs. So the muscle that's in the armpit is a small muscle, but it's part of that. It's that fourth rotator cuff muscle. So most always when people are complaining to me about all this stuff here, this is so tight, and they feel it in their shoulder blade, it's from this muscle in the armpit. So we're gonna roll to our side. And again, kind of a beginner version is you're just using your upper body weight. Arm is here, rollers underneath, my legs in front to kind of stabilize myself. And I'm there's more weight on the floor than there is on the roller. And it's kind of a army crawl really, but you're just doing a subtle motion like this. So you're just in the armpit, rolling, I don't know, maybe 6 inches. And so where I'm at is right here. And I'm just rolling along the outer edge of your scapula, your shoulder blade. The more you want to get back here, you lean back into it. Then the more you want to get this stuff right here that gets tight from all of us being like this, then you roll more on the front side of the arm or the shoulder. So if I was doing that, you can either angle your roller or just angle your body. And I just lean more forward into it. And again, I'm just going from about the middle of my bicep, which is the middle of my forearm, into that armpit. So it's a really nice way to get all of this, and some of our lat muscles, those big back muscles that bridge a big portion of the side of our back. So that, again, I'm not gonna show both sides, but you would then flip and do the other side. Then let's go right into the lower back and legs, or the glutes, if you will. So for our buttock area, and low back we talked about this the last time. It's a very tender area because there's not as much meat here as there are in these big muscles of our back or of our butt, of our legs. So with your low back, you're just gonna very gently lean against it, but most of the weight's gonna be on your bottom or in your legs and in your arms. So if I was doing my low back, I would just lean against it very lightly and put most of the weight at my feet and my hands and just lift up a little bit to roll that low back. But you'll be amazed that when you actually do more of the rib cage up here and the glutes, the buttock and the legs, you'll target what's happening in your low back. So I don't recommend you not putting much weight on your low back directly, if at all, with a foam roller. So in your glutes, where we all have more meat on us, you're sitting on it and you're literally using your body weight against it. So it is easy, it's nice to just roll both sides and see the difference. Then to get one side versus the other, you just bend your knees and kind of lean more into the left. Bend your knees, lean more into the right. But it's this nice motion where my hips are on it, but most of my weight's in my arms and on my feet. And it feels fantastic. Then we're going to go into our hamstrings. And that is all of the back of our legs. Everything that's connecting our hips and our bottom to our knees. So same thing. I think what we showed last time we're going to expand on, and lifting up and just rolling through the back of the legs. I would start here and you're just going to roll all the way down past the knees. I'm going to go out of the view for a second, all the way to the calf, all the way to the ankle and back. And what we talked about last time was changing how you get all of those different muscles back here is moving the angles of your toes. So you're gonna toes straight up, gets kind of right down the center. When you put your toes pointed out, you're gonna get the outside of your legs. So then you're gonna do all the way up and all the way back with your toes pointed out. And then you're gonna pay attention, what feels different? That doesn't feel very different. That feels okay to me versus when my toes were straight up. So then we're gonna point our toes in and we're gonna roll the back. And this is getting the inside of the back of the thigh and inside of the calf. And again, I feel less there than I did in the other position. So you're just gonna note that, spend more time where you need to. And that's how we do the lower. Now, sometimes when doing that, it doesn't feel like much because the weight of our legs just on the roller isn't as much as when we sit on there with our whole body. So the kind of intermediate or advanced move would just be if that doesn't feel like much and you need a little bit more weight, then you do one leg at a time and you cross the ankle and you add your right leg weight to your left. So now the weight of both legs are on the back of that roller or against it, and then roll. And there's where I feel what I need into my calf and knees and Achilles, right? And then switch. This leg goes up top and see how that feels with extra weight upon the roller. Okay. Now, the love-hate relationship with the IT band. This one feels sometimes one of the most uncomfortable to do because we never get it worked on. It's the tendon from top of your hip to that notch on your knee right here that most people don't get touched even by a massage therapist many times. That is kind of helping connect the quad muscles to the back of the hamstring. So it's that in between. And again, it's not a muscle, it's a tendon. So those adhesions build up and it can get really sort of sticky and make that glide or that movement not as smooth between our hips and our movement at our knee. So we've done this one before and you're going to do both sides, but again, you're going to come back onto your side. And I feel like the most common, I would say almost mistake or misnomer is that when people roll, they only roll from like here to here. The IT band goes all the way up to where we put our hands on our hip and it comes all the way down to this notch where our knee bends. So I want you rolling from the notch to the top of your hip. So you're going this much further up here than most people do, and this much further down here than most people do, okay? And again, we're not hanging out to torture ourselves. We're gonna just glide on by, and when we find a spot that's talkative, we're taking note of it, and we're keeping on going. And we'll come back over it again, but we're not hanging out, creating discomfort for any length of time. You're just getting reminded where you need to spend a little bit more time more often. But again, this isn't torture. So I'm coming up right near the top of my hip here. And again, for balance, elbows are doing all the balance here on my forearm. Putting one leg, the top leg in front of me is creating the stability here where I just feel like I can move myself without tipping over, right? So use your, again, arms and kind of toes or foot to army crawl. I'm gonna go out of the screen a little bit so you can see me going from the top all the way down to the notch on my knee. And then I'm working myself back up to the top of my hip. So back and forth, I would say at least 3 times so you can really see where you are. And then you would turn and do the other side. Now to do the front of our legs, our quadriceps, that's a lot of what gets tight between there that affects our knee and the pulling on our kneecap, and also affects kind of that inner thigh and our psoas, which is the other one we do a lot of work on in here when our hips or our low back are tight, right? That's the front of the hip. And so I'm going to show you those 2 or 3 in a little different way than we did last time. So when we do our quads, we literally are rolling from the top of our hip to the top of above our knee. Don't ever cross the knee. Don't hit that kneecap. But then we're going to do a different one, what I kind of call a frog leg. So I'm going to try to face you so you can see a different way of doing it. For our adductors, those are our inner thigh muscles that come into our groin. And then the front of the very part of our belly, where our hips cross here, is where that hip flexor is, right? Deep into here that allows us to do this bend. And so there's an easier way for women, right, to roll this because we don't have anatomy that gets in the way, but we can roll right across our bellies. For men, you're going to watch me kind of do that same motion for the corner of this hip flexor with that frog leg, the way we would do our inner thigh. We're going to just be able to hit this inner ridge of it. And that's about it with a foam roller. So from this direction, you'll see me come onto hands and knees, all the weights on my forearms and on my toes. And I'm just going from that upper part of my thigh to above my knee. And again, same as when you're doing the back of the leg, point the toes in and you'll get an inner part of that thigh. Point your toes out and you're getting more of the inner thigh. than the outer. So again, just change the position of your toes so you can get the part that is most needed for you. And then I'm going to try to face you so that this looks more clear as to what I'm doing. But I would come again onto belly and forearm, and then what I call a frog leg position with the thigh, and then bring your foam roller kind of, parallel with you. And then it's easier to just roll this way for the inner thigh. And for men, this is the way you'll probably just do psoas as well. You'll come and bring it, I'll try to get my arm out of the way, a little bit closer to the inside of the hip. And that's as safe and as far as you want to go with that, so you don't hurt yourself. But that's a way to get that inner thigh stuff. Like when we have, so somebody would ask me, well, who needs to do this one? Well, I think about our patients, right, Kathy, the ones that have hip and knee issues. It's a lot of times inner thigh, as well as the psoas that I'm about to show you. Anybody who's had any injury, anybody who's had stuff at the ankles. A lot of times we overcompensate with the hip or the motion our knee and hip do together, right? Then if I was doing more of the psoas for a female, you could do it that way, or you can come back to here and literally roll then from the pelvis up to your belly button. So here to here. So when I do my quad, I just continue up and roll all the way to my belly button. That gets this hip flexor crease right here. So I just continue to walk down and then walk back up very slowly across my pelvis, all the way to my belly button. And again, point your toe in and out, and you'll get more of what's happening right at the cross of the hips. Okay. So a couple different ways in which you modify where this is so that you're getting as much connecting points as you can without overdoing it or without getting, you don't want to obviously hurt yourself and roll over parts we don't need to roll over. That shouldn't be rolled. Let me see making sure I'm not missing anything. IT psoas. Okay, that was IT and psoas. So one last point that I think we didn't talk much about last workshop with foam rolling that I want to point out is anytime you're doing some of these motions where you're on the floor or you're in more of like a plank, right? Where you're on your knees and your toes or your knees and your elbows or your elbows and your toes, you are wanting to think about engaging your core. So going back to that workshop we did at the beginning of the year with strong back, and it was all about our core. It was all about, are we engaging here while we're doing motions, right? And so when we are, here, I don't want to be like this. I don't want to be like this. I want to think about, I'm almost engaging here. So I have a nice flat back and I'm using my core just to hold myself up. And it's engaged while I'm doing this rolling, but that way you're not doing this and your belly's not sagging to the floor, right? That just hurt doing that. And we're not like this either. So think about neutral. Neutral is belly kind of tucked in or engaged and back is flat. Same thing. When I'm doing most of this, you see me turning to talk to you, but I keep my neck at neutral. I'm not arching my neck. I'm not dropping my neck down. My neck and spine is in alignment and just should be straight or as straight as possible. So again, we're not overusing muscles that we shouldn't. So I want you to think about it from your core as well. Because if we're not thinking about how we're engaging our muscles, then we're stretching, we're rolling some, but we could be disengaging or not engaging the other ones properly to give us the most proper posture when we're even rolling. So the last thing we're going to end with is going back to the spine and doing kind of a modified move that we're going to call the snow angel, because it's like when you do wall angels, like I started with, but it's how in which we use the roller to support our posture muscles in our frame. So once you've done everything, I like coming back here because it's a good place to just drop in, kind of when you end a yoga class or you end a workout and you're just doing breath work and kind of drop it into your body in that cool down phase, if you will. So if I wouldn't have talked through all of that, you all could have done most of both sides of your body in 5 to 10 minutes. And so I like people dropping back in, or even if this is the only one you're doing, and you're doing it to pre-post your spinal exercises, right? Is to go into what is more of like a snow angel or wall angel. That your knees are bent, your feet are on the floor, you're grounded barefoot, preferably, and you're just going through that motion of what that feels through your spine and your shoulder blades to just take a deep breath in and feel where that feels different. I mean, you could do movement side to side with your arms here versus here versus here versus here. That's good to do. But I want you to just think about breath work. Think about that breath in from the belly all the way up and then all the way out. And if you're incorporating it to the next level and you know what 4-7-8 breathing is, like we do, right, to tap into our parasympathetic nervous system, that polyvagal work, that's that calming, zen, safe, relaxed, peaceful place. Then you're taking a breath in for a count of 4 seconds. You're holding that breath for 7, and then you're letting it out slowly out your mouth for 8 seconds. So I want you to think about doing that while you're doing your snow angel. So a count of 4 in, hold, and out. Eight seconds out. And that's a beautiful way to come back to center of your body and your brain and your nervous system as you've just loved on your spine and all your muscles, and come to just a great centered place to end your stretching routine and your foam rolling routine. So I want to end with letting you know that as we're loving on our muscles this week, we're also loving on our spines, and we're loving on our nervous systems and loving on our patients. It's Patient Appreciation Week in 2 weeks at the end of the month, the 26th through the 29th. And so come have fun with us the next couple weeks in the office. We're going to be doing a lot of playing next week. We're going to be doing a lot of fun celebrating tomorrow for Valentine's Day. And what it is it's our time of the year to share chiropractic and getting our spines checked with those we love. So we talk about sharing the love, and if you get your spine checked, who do you know that doesn't? And that you can send them one of our lovely Valentine postcards that Dr. M put together to invite them into our office. We have a board right here. I don't know if you can see it in the video of about, well, I think we started with 13 slots. I think we're working on, we've got about 10 left. And when they're gone, they're gone. But they are days throughout that whole week and times throughout that whole week that anyone that you know, if they want to call and come in and get scheduled for that appointment time during that week, gets checked, a consult, an exam, our scans and x-rays at our expense. So it costs them nothing to come in and see if there's anything in their health that they want to be aware of, anything that's related to their nervous system and their spine and their functionality. And if we can give them any information about them, that's us in wanting to share with our community and share the love like we do with you guys. So all they have to do is call and say they know you and they just want to get on the schedule for that week, and the girls will set them up with whatever's left in an appointment time that works for them. So share the love, everybody. Great to have you with us today. And thanks for being with us. Send us some comments or let us know in the office what you've tried, what was something new, what you found was the most talkative. That'll help us help you in your care. And we'll see you next Tuesday. Thanks so much.
Thanks, Dr. Chris. That was really fun seeing you in action.